Today is the day of your physical assessments. First off, you will start with a posture assessment and then you will move on to the fitness assessment. Posture assessment will help you to identify which muscles are overactive and which ones are underactive. Poor posture is usually the cause of muscle pain, poor mobility, restricted movements. The best way to assess your posture is by recording yourself. For the overhead squat assessment, start with your feet about shoulder width apart, get your arms up above your head and squat down slowly facing the camera by sitting backwards. So repeat that for 4 times. After that, record the video side view, same thing, arms up and squat down until your legs are about 90 degrees. So from this movement you can start, once you record, you can start assessing your posture. So we're gonna start from the bottom, so from your feet, and then moving up to the top. So when you squat, if your heels are lifting off the floor, that means you might have tight calves. If your feet are twisting out as well and your knee stays still in the same line, that's again a sign that your calves, especially the outside of the calves, are tight. Once you assess your feet, then move on to the knees. So when you squat down, if your knees are going inwards just like that, that might be a sign that your inner thighs are tight or your IT band is tight. IT band is from the hip moving on down all the way to the knee. And if your knees are going outwards like that, that's a sign of your glutes being too tight. So once you assess the knees, move up to your hips area. You can see a few things on the hips area. So when you squat down, if your all weight is shifting one way or another, that means one side of the glutes is tighter than another, or your inner thighs also, one side is tighter than other side. And from the side view, you can see when you squat down, if your tail bone is tilting forward, so all your pelvis is tilting forward, that means your glutes are tight and your hamstrings are tight. If you have a excessive arch, for me it's pretty hard to do, that could be a sign of tight hip flexors. Then moving on to the upper body. So from the side view, when you have your arms up and you squat down, so if your whole body is leaning forward, that could be the sign of, again, your hip flexors being too tight and your calves are being too tight. And if just your arms are dropping down, that's a sign of your chest muscles being too tight. From the front view, you can see 2 things for your upper body. So when you squat down, if your arms are going wide to the side, that means your lats are tight. And if your arms goes like this on an angle, that could be the sign that your biceps are tight. So that's about it. Record your video and start the assessment.